Hello, everybody. Lee Pace here from Plano, Texas, and I'm going to demonstrate today an all soft tissue lateral meniscus transplantation with a specific focus on root fixation using the SutureLoc suture anchor. So the first thing we're going to show is the meniscus transplant itself. You can see this is all soft tissue. There are no bone plugs on the meniscus. It's pure soft tissue. We have one shuttle stitch that is here sort of at the junction of the anterior aspect of the popliteal hiatus and body that we'll use to help pull the meniscus transplant into the joint. A little technical pearl, if you look at the meniscus transplant itself, you can see there it's devoid of any attachments right here, capsular attachments. That's the popliteal hiatus. I will typically put the suture in the anterior aspect of that because that's where I'm going to place a passing suture lasso wire to pull it in, and so that helps line me up appropriately. So the first thing to show here is the actual SutureLoc anchor. At the distal end, this is the suture loop that deploys the bunching mechanism, which is located here. So you pull on this, and that bunches this up here. What you can see coming out of the top are the repair and the converting stitches. The repair stitches are solid, blue and white, all the way down to here. You can see the mark right there, and that's where you don't want to load any more into that when you do the conversion. And then the tiger tail sutures with the loops are the converting stitches right there. And the continuation of those is down distally here. The disposables for this kit are located up here. We have the 2.4 millimeter cannulated guide pin. We have the suture lasso wire, which will go through here. We have the knee scorpion needle. And then lastly, we have an 8x3 passport. Okay, we are now in the joint, and we have prepared this specimen for the meniscus transplant. You can see that we have just a rim, millimeter or two rim of meniscal tissue all the way around here. We have also prepared the root sites. So you can see here, if I adjust my objective, here is the posterior root, and you can see that we have cleaned it off with regards to soft tissue. It is right behind the ACL. And we've also removed some of this cartilage off of the lateral tibial spine, and that allows it to get a little bit better access with our root guide right back here. And then we've also prepped right here our anterior root. So you can see we've trimmed that back, and we have some exposed bone right through here where we're going to put that anterior root right there. So now what we can do is we have our standard point-to-point root guide. And when you're doing the lateral meniscus root drilling, each patient I've found is different. So sometimes it's easy to access the roots through the medial portal. Sometimes it's easier to access them through the lateral portal. I think you just take each situation independently and figure out what works best. This one we've already looked at and found that you can see we can get a good spot right there through the medial portal. So we're going to just hug that down to bone right there, and we can push this up to skin. So one thing you can see here is that the length of our transtibial tunnel will be very long. This is going to be just about 50 millimeters. So that's going to be plenty of length for us to deploy the bunching mechanism in this transtibial tunnel. And we'll check that pin position. And that really looks to have put it smack dab in the middle of our root insertion site. So I'd say that's pretty perfect. And so now what we can do is we can take this out, and then we can back this up a little bit. So one thing to note, on this cannulated guide pin, there is a core pin inside of it. And you can see here that I can turn it like this, and that helps push out any bone that got into the tip of the guide pin. Now that that's clear, I can now unscrew that, and I can take that out. And now we're going to place our suture lasso wire up here. I'm going to switch portals now because I'm going to want to bring the meniscus in through the lateral portal. So I'm going to come over here. We'll take a arthroscopic grasping device. We're going to grab that suture lasso wire. We're going to bring it out the lateral portal, like so. And then from there, we can take out the transtibial guide pin. So we're going to clamp that there so that does not come out with us. And that can often just pull out by hand, just like that. We have our suture lock here. We're going to pass the distal end in first. And when we load this up, we're going to bring it through the suture lasso. And one of the key points here is to make sure that you have it folded over above the point where the bunching suture is. We don't want it down here like this. We want it up here like this. And that'll help it pass through easier. So now we have this. We're going to pull this in. Now that we're this far, now what we're going to do is we're going to find the side, pull that the rest of the way out. And now as we pull the suture lock into position the rest of the way, it's going to be more in line. And so we're going to bring that down. There we go. And now we are subcortical. So we have the suture loop down here. Now with a little bit of counter tension up here, I'm going to pull on this, and this is going to deploy the bunching mechanism, and that's going to set the suture lock anchor in the subcortical bone. So there I am pulling, just like that. I can take advantage of the loop, get my fingers right in the loop. You can see that suture translate, and now that is deploying the anchor in the subcortical bone. And now that we've got the bunching mechanism deployed, we can now check it. We can pull on this, and you can see how it's pulling the whole tibia with it. So that's solidly deployed in the subcortical bone. What we're going to do now, I've switched portals. I'm going to bring all the sutures that I don't want to immediately use out this medial portal. But before I do that, I'm going to put a clamp right here, and that is going to protect me from inadvertently pulling one of my conversion stitches out and then having to start all over again. I'm going to come here. We're going to want to take all of them except this. We're going to probably start with this blue repair stitch here. We're going to leave that in the lateral portal. So we're going to take all three of these, and we're going to bring them out. Just like that. And now we've got the three sutures that we don't want to immediately use out the medial portal, and then we have the stitch that we want to use initially for the initial root fixation, as well as to help us bring the meniscus transplant into the joint through this lateral portal. We are going to switch the camera back to the medial portal, and now we're going to use a mini suture lasso, and we're going to place this just in front of the popliteal tendon. We have the mini suture lasso in here. And we've got that right there. And I'll pull that out. So now we have this suture lasso wire and the repair stitch out the lateral portal. Now, the meniscus transplant is probably going to have a hard time fitting through this little bit smaller passport. So we are going to remove that to pass the meniscus into place. So we're going to remove that first. And now what we're going to do is we're going to get the meniscus right there. We have our scorpion right here. And we have our root repair stitch. And so this is, we're going to pass this through here. And I'm going to put this one a little bit farther back and through. And then next, we're going to take this shuttle suture and we're going to load it into the suture lasso and then pull that out laterally. And that's just going to help us pull the meniscus into the joint into position. And now we can start shuttling this into place, and we'll take a grasper and we're just going to kind of help work this in. We're going to grab this and we're going to kind of pull on that and pull on this and just kind of get it started in there, and then we can get the camera and now we can see it starting to come in. So we've got the meniscus somewhat into place here, and you can see we can easily get it right back there. It kind of wants to come back on us a little bit, but we're going to fix that in just a sec because we're going to start converting this. So we're going to grab the tiger tail. We're going to unclamp, I'm going to bring that through. So next, we're going to convert the repair stitch. So we're going to take the solid blue repair stitch. We are going to load it up through the loop. Again, we're going to get it right next to, but not past the mark. And then we are going to now unclamp this temporarily. We are going to identify the other end of the converting stitch here. And we are going to now shuttle this in the knee. So there we are. Now I'm going to put the camera back in. We're going to pull. And then we can go ahead and pull a little bit more tension on that. We want to get it close, but not all the way down. Okay, good. So we have that root pretty well in place right there. And now you can see how this is coming in. We've got that in pretty good there. We've got the shuttle stitch holding it over there. Okay, now we can go ahead and we can place the other repair stitch and convert that and then definitively tension this into place. Reclamp that tail. And now we'll take the white repair stitch, load it in the scorpion, and then in the joint. And now we're going to place this one a little bit more anterior on the root like that, and that looks like that should be pretty good there. We can pull that out. Like so. Now we'll convert the white stitch in a similar fashion. So we'll come through like so. Okay. And then we will unclamp here. And now we can pull this into the joint. And now we can watch that. We can get it close. We can do some last-minute suture adjustment to make sure we like it. We can pull that one. We can make sure the blue one is around the side as well. Like so. And then we can sort of just kind of pull them down right into place, right where we wanted them to be. You can see how that just dunks at exactly where we wanted it to go. And we have a working length close to 0 for our posterior root. And so that is fixed into place quite nicely now, and that is really strong. That is not going to go anywhere. Now that we have the meniscus in the joint, we're going to reinsert this passport just to make the suture management for the second suture lock a little bit easier. So we're drilling the anterior tunnel now. And you can see that this is just under 40 millimeters, okay? This is going to be enough for the suture lock. You really don't want a tunnel less than about 30 or 35, otherwise your bunching mechanism is not going to be reliable. So we're going to double check this and make sure that we're going to be able to use this. If you've got a small patient and you're not going to get that long of a tunnel, then you can fix this anterior root with a swivel lock either in the joint itself, or you could do a transtibial swivel lock here in the front. There are obviously several options for anterior root fixation, but we should be good in this specific situation to proceed with another suture lock. Okay, take this out. And there we can see our anterior horn is ready and waiting to be fixed, but there you can see the blush of our guide pin. And so we can advance that just a little bit. Okay, good. Okay, and so there's our guide pin in place. You can see the core pin is already advanced, so we have a nice clear path, and you can see that's right where we aimed. So that's right where we want our spot to be. All right, we're going to switch portals to grab this. Okay, good. And now we can take that out. Now we have our second suture lock. And why don't you go ahead and pass that through. And then we'll bring that down. Okay. Into the joint we go. There you can see it. We're going to get it just past right there. Good. Little counter tension on that. And then we'll isolate the suture loop down here. I have my fingers through the suture loop now. And then I'm going to deploy like that to deploy the bunching mechanism just in the subcortical bone right there, and that feels really firm, so that's good. And we can give some tension back, and there's no give on that. Okay, and then we'll clamp here, again, so that when we are shuttling sutures, we don't inadvertently pull our converting stitch up out. We want to make sure that converting stitch stays out the bottom of the suture lock. Okay, we got those. Okay. Now we'll switch this back. We'll get the scorpion. Right there. And then we'll determine where on the meniscus we want to grab that. And that looks, if I get that just a little bit more towards the end, that looks like that's going to be a good grasp of meniscus there. We'll just push this back in. Good. Okay. Now I'm going to grab the converting stitch from right here. Again, making sure we keep the clamp on. Out we come. And now we can convert. There we have it. Temporarily unclamp. Find the blue tiger tail. Okay, and go ahead and give it a pull. And that's around the end of the meniscus, just how we like it. And I think we can probably stop right there, and then we'll have enough leeway to do the other two. And I'll just grab those right now, and we're going to clamp to make sure we don't pull out the converting stitch. We're going to pull these out the passport. Okay. I'll take the scorpion. So now we'll come in here, and then we'll determine where we want to pass the other stitch. If we want it a little bit further in, so I can grab some meniscus here. And so I'm going to come a little bit more on the inner free edge on this one, like that. And now we'll convert this and then do our final tensioning and positioning of the root. Okay, and we'll unclamp. We'll find the black and white tiger tail and go ahead and pull that. And now we'll do the final tensioning. We have the sutures kind of where we want them on the root, and now we can just pull that down just like that. You can see we can just pull both right into place just like that. And that's super solid fixation that we have. Now, you can see here that this meniscus is actually a little big for this knee, but it was very good for demonstration purposes because you can see the solid fixation we have right here in the back, as well as right here in the front for an anatomic placement of soft tissue meniscus transplantation. Now that we've got the roots fixed, then we are going to sew the periphery of the meniscus to the remaining meniscal rim. And so this can be done with a variety of implants and instruments. You can go inside out with the Zone Navigator. You can go all inside capsular based with the fiber stitch. Some patients, you can actually even do an all inside meniscal based with the knee scorpion in the posterior horn. You can also go outside in with the mini suture lassos, but you probably only need about 6 points of fixation for a lateral meniscus transplant. So now we have our suture locks here. We have the roots fixed. One thing that you can do if you are worried about getting them confused, you can mark one of them and designate whichever one that is to be posterior anterior. So here we could possibly mark the posterior one with a purple marking pen and just remember that that is the posterior root. Anyway, we can retension these things if we think we need to. We can make sure that all the slack is out of that. But then this is all soft tissue fixation, and this can be cut flush at the bone. And so we'll demonstrate that here on the posterior suture lock. And so we're going to get a knife and just cut that right at the tibia. And that's it, and that's the end product.